I'm Dr. Mark Lobanoff. I'm here at OVO LASIK Lens, and lens is part of our name. We have a lot of patients that come to us for cataract surgery. So a commonly asked question is, what exactly is a cataract? Inside of every eye, behind the blue or brown iris, there's a natural lens. And if you look at the lens of a 20-year-old patient, it is crystal clear. A 30-year-old patient has a trace amount of haze in that lens. A 40-year-old, a little bit more, 50 more. Eventually, that haze builds up to a point where it's blocking the light, and the focus, the image that the patient sees is just not as clear as it used to be. At night, that haze scatters the light, creates a lot of glare and halo, makes it harder to drive at night. And these are the classic symptoms of a cataract. We can fix this though, and technology and the surgical techniques and the lens implants we use have really come a tremendously long way, even in the last 5 years. Cataracts are incredibly common, and in fact, everyone will eventually get cataracts if you get enough birthdays under your belt. Again, the good news is we can fix this. It does require surgery, but not a bad surgery to go through. Surgery is painless, quick, takes about 15 minutes, and as early as the next day, patients tell us that they can see better. So very quick recovery. One of the things we've done at OVO LASIK Lens to make that surgery more comfortable, actually even enjoyable, is to create an office-based surgery center. So in the past, we would have to take patients to a hospital or ambulatory surgery center for cataract surgery. And this was a little bit impersonal. You had to get a history and physical. There were IVs involved. Here at OVO LASIK Lens, we have the only in-office cataract surgery suite in all of Minnesota. And what this means is you don't have to go out and get a history and physical. You simply come in. No needle sticks, no pokes, no IVs. In fact, we don't even restrict you in terms of eating and drinking before surgery. It's in a pleasing, comfortable environment, and these days there are a lot of lens options. We can do amazing things with lens implants. We can correct your distance vision without glasses. We have lenses that allow you to see near, intermediate, and far without glasses. In fact, we use every single lens that's available in the United States here at OVO LASIK Lens, so your choices are vast. And the surgeon's going to sit down with you, talk to you about your lifestyle, talk to you about your hobbies, talk to you about what your goals are. What would you love your vision to look like for the rest of your life? And we'll match the lens that will meet those expectations. One of the critical things, though, to make those high technology advanced lenses work is to have the best technology here in the operating room. And that's where OVO LASIK Lens excels. We have 3D heads-up visualization displays. We have laser-guided tracking. We can track where the patient's visual axis is so we can center the lenses perfectly. And we're the only center here in all of Minnesota that combines both technologies into one OR. What this means for you as a patient is you get the most out of that lens technology while reducing any potential risk. From those early days, cataract surgery evolved and began to be done in ambulatory surgery centers. And now the next stage of evolution is what we have at OVO LASIK Lens, which is an in-office, office-based cataract surgery suite. In fact, our center here is so advanced, we get patients flying in from all over the country to have their surgery here, specifically because of the lenses and technology that we have, as well as the experience of our surgeons. My own friends and family have come here. I've operated on my best friend from med school. He's a radiologist down in Louisiana, and he flew up here because he had early cataracts. My wife had restorative lens exchange, which is very similar to cataract surgery, where we take out the natural lens, replace with a lens to allow that patient to see near, intermediate, and far without glasses, meaning she'll never get cataracts. And she now has great vision at all distances without glasses. So again, I treat my own friends and family here. I believe in our staff. I believe in our technology. I'm very proud of what we've built here. There's one myth about cataracts that I want to dispel. And years ago, ophthalmologists would say, we're going to wait till this cataract gets right, which means we would wait until that cataract got really bad. Patient's vision was terrible before we sent them for cataract surgery. This is really no longer the case. As the surgeries become faster, safer, better, as our outcomes have gotten better, we now say, why wait? Why not address these cataracts early as you're just beginning to have symptoms so you can enjoy good vision longer? So what is the next step? you can come into OVO LASIK and Lens. You can meet your surgeon. We'll do a complete exam. We'll talk about your cataract. We'll explain the surgery in detail. We'll talk about your lens options. But if you have an optometrist locally that you trust and love seeing, by all means, go see them. Have them do an evaluation and have them refer you here for your surgery. At OVO LASIK and Lens, we have invested in every advanced technology to ensure you have the safest and best outcomes from your cataract surgery.